Sponsored by Senior Advisory Group.
Hi, I'm Steve Stern, President of Senior Advisory Group, and I would personally like to invite you to take a little bit of your time to increase your income. We come on out to Scottsdale, Arizona, so we can show you how to dramatically increase your income without increasing your efforts.
For more information, visit senioradvisorygroup.com.
In response to the controversy over healthcare reform's individual mandate, a new Government Accountability Office report outlines proposed alternatives to the requirement. The report lists the proposals healthcare experts most commonly suggest as viable alternatives to the mandate. The report clarifies that the GAO does not endorse any of the proposals, nor did the GAO investigate their effectiveness or legality. According to the GAO, the most common alternatives include implementing open enrollment periods and imposing penalties on individuals who enroll late, auto-enrollment for employer-sponsored health coverage, carrying out a public education and outreach campaign, imposing a tax on uninsured individuals and employers who don't offer coverage for uncompensated care, and restricting federal benefits such as college loans to those with insurance. Healthcare experts are proposing these alternatives in case the Supreme Court strikes down the individual mandate. However, a Center for American Progress study released last month says alternatives to the individual mandate would not result in as many uninsured people gaining coverage as under the individual mandate. In particular, the study says imposing penalties for late enrollment and implementing auto-enrollment for employer-sponsored health plans are faulty alternatives. If the Securities and Exchange Commission gives FINRA oversight authority, FINRA will specifically adapt its rules for investment advisors, according to Chairman and CEO Richard Ketchum. FINRA would implement regulatory oversight that is tailored to the particular characteristics of the investment advisor business, says Ketchum. He emphasizes the need for more frequent exams to ensure compliance and reduce fraud, adding that FINRA does not believe extensive self-regulatory organization rulemaking is necessary. FINRA currently oversees more than 4,500 brokerage firms, but could expand its oversight to include investment advisors. Some trade groups oppose the expanded role, and FINRA says that due to its limited budget, the SEC should use an SRO to conduct examinations for investment advisors. The Dodd-Frank Wall Street Reform and Consumer Protection Act could cost as much as $2.9 billion over 5 years, according to the Government Accountability Office. The first year of Dodd-Frank will cost the 11 agencies directed with implementing the law a total of $974 million. The agencies, which gave the GAO their first-year total costs related to Dodd-Frank, say much of the expense will be recurring. However, taxpayers will likely only fund part of the implementation process. 6 out of the 11 agencies are funded in part by assessments on the industry, 1 fully by revenues collected, while only 3 are partly or fully funded by congressional appropriations. State insurance regulators are waiting 4 more weeks before they decide whether to support legislation to exclude agent and broker commissions from medical loss ratio calculations. A National Association of Insurance Commissioners panel was expected to vote on the issue during the group's spring meeting last weekend, but instead asked NAIC staff to provide more data on the MLR issue. The MLR calculations require insurers spend at least 80% of premiums received on health care. Agent and broker groups lobbied for their commissions to be exempted from the health reform law's MLR calculations, but the Department of Health and Human Services decided to include commissions as administrative expenses in their final rules released in November. Now producer groups are pressuring the NAIC to endorse legislation to exclude commissions from the MLR calculation. For more on the industry, visit producersweb.com.